For decades, when we talked about age-related cognitive decline, Alzheimer's disease completely dominated the conversation. But there's this massive paradigm shift happening in neurology right now. We're finally realizing that cognitive decline, it's largely a silent vascular problem. It's literally an invisible epidemic happening right inside the brain's circulatory system. So, in this explainer, we're going to dive into the clinical data and some truly incredible high-resolution imaging that's completely rewriting how we understand, diagnose, and ultimately prevent dementia. Here's our roadmap for this clinical review. We'll start with the VCID paradigm shift, move on to comparing large strokes versus small vessels, then spend some time decoding high-resolution MRI, and finally wrap up with prevention and therapeutic strategies.
All right, part 1, the VCID paradigm shift, or what we're calling the invisible epidemic.
So take a look at the traditional view on the left here. Vascular dementia was defined almost exclusively as a post-stroke phenomenon. Basically, a single etiology. You had a major stroke, and then you developed dementia, right? But the modern construct over on the right is so much broader. VCID, which stands for Vascular Contributions to Cognitive Impairment and Dementia, reflects this reality that cerebrovascular disease is highly prevalent, cumulative, and often totally silent. It impacts cognition through all these non-stroke pathways, slowly compromising brain function over time, honestly, long before a patient ever sets foot in the emergency room. The really crucial point to take away here is that pure single etiology dementias are actually the exception, not the rule. Multifactorial or mixed dementias are way more prevalent. Clinical pathologic studies are showing us that these vascular changes frequently co-occur with neurodegenerative processes like Alzheimer's pathology, which just compounds that multifactorial brain injury. Think of vascular lesions like structural cracks in a dam. They slowly strip away the brain's cognitive reserve, making it so much less resilient to the rising waters of Alzheimer's pathology. Moving on to section 2, let's look at the pathology from the macroscopic down to the microscopic. Large strokes versus small vessels. Now, obviously, multiple strokes generally increase cognitive risk. But did you know there are rare, strategic locations where just a single, localized infarct can independently trigger dementia? We're talking about highly connected network hubs here. The thalamus, the medial temporal cortex, the anterior corpus callosum, and the dominant side angular gyrus. If a large stroke hits just one of these really vulnerable regions, a patient's episodic memory and functional skills can be instantly and severely compromised. But what about the small vessels? This is where the silent damage really occurs, and it's driven by two primary culprits. First up, arteriolosclerosis. This is the thickening of arterioles driven by age, hypertension, and diabetes. It primarily attacks the deep penetrating vessels in the thalamus, basal ganglia, or brainstem. On the flip side, we have cerebral amyloid angiopathy, or CAA for short. This one is defined by beta-amyloid peptide actually depositing right into the vessel walls, leading to a total loss of normal wall structure. CAA is primarily driven by advancing age, and it targets the superficial lobar brain regions and the cerebral convexity. So you have two entirely different mechanisms, two different locations, but both of them absolutely devastate the brain's microplumbing. All right, let's get into the really cool stuff in section 3, decoding high-resolution MRI. Let's decode some scans. Okay, so here we're looking at a classic lacunar infarct, which is a super common feature of arteriolosclerosis. Notice how we're pointing to the left thalamus on this flare sequence. You can clearly see this hyper-intense, bright rim surrounding a really dark, hypo-intense cavitated core. These lacunae range from about 3 to 15 millimeters, and they represent a localized pool of fluid where deep brain tissue has literally died off. Let's zoom in even further, though, to see how this microscopic damage builds up over time. What you're seeing here is a diffusion-weighted MRI showing an acute microinfarct. See that tiny punctate hyperintensity right there in the left centrum semiovale? We're talking about a lesion that is under 3 millimeters in size. It's minuscule. These are substantially more numerous than the larger lacunae we just looked at, but obviously much harder to visualize. Yet, pathologically speaking, the cumulative effect of these tiny, acute microstrokes is highly, highly significant for cognitive decline. Now, what's really interesting about this slide is how MRI helps us differentiate between our two small vessel culprits based entirely on where the bleeding happens. These T2 star-weighted sequences you see are highly sensitive to iron in old blood. On the left side, we can see deep microbleeds, those little dark spots, in the pons. This deep penetration is the classic hallmark of arteriolosclerosis. But on the right, notice how the microbleeds are located out in the superficial lobar regions of the cortex? That specific peripheral pattern, that is the absolute radiologic signature of cerebral amyloid angiopathy. And here is the cumulative diffuse white matter injury that results from small vessel disease, captured beautifully on a FLAIR sequence. You see those confluent, glowing white patches clustered around the ventricles? Those are white matter hyperintensities. When this vascular injury and demyelination becomes extremely severe and diffuse like this, it's clinically recognized as Binswanger's disease. Basically, this represents massive structural disconnection within the brain's network, which drastically slows down a patient's processing speed and executive function. It explains why a patient might suddenly, struggle with daily planning or multitasking. To actually quantify that exact network disconnection, researchers are now using advanced imaging like diffusion tensor MRI. And a really key metric emerging from this is PSMD, which stands for the peak width of skeletonized mean diffusivity. I know, it's a mouthful. It's a complex histogram-based calculation, but what it essentially does is sensitively measure the loss of white matter's structural integrity. It literally quantifies how badly the brain's internal communication networks are disconnected. And the crazy part is, this correlates directly with clinical cognitive performance and, remarkably, even physical markers like gait speed. Okay, let's bring it all home in Section 4, Prevention and Therapeutic Strategies. How do we actually stop the damage? The most powerful tool we have right now isn't some fancy new miracle drug. It's the rigorous, evidence-based management of vascular risk factors. The frontline targets are super clear: hypertension, diabetes mellitus, dyslipidemia, and atrial fibrillation. Identifying and strictly managing these conditions is absolutely essential if we want to protect the brain's microvasculature from further deterioration. Put simply, we absolutely have to treat the vessels if we want to save the neurons. And guess what? We have the clinical trial data to prove this actually works. The landmark SPRINT-MIND trial looked at targeting a strict systolic blood pressure of less than 120 millimeters of mercury compared to the standard 140. The results were honestly astounding, a hazard ratio of 0.81. To put that into perspective, that represents a statistically significant 19% reduction in the rate of mild cognitive impairment for the intensive treatment group. I mean, this is profound, real-world evidence showing that strict blood pressure control directly preserves cognition. So, what does this all mean? We're going to end with this thought. If pure neurodegenerative dementia is rare, and age-related cognitive decline is actually a mixed pathology that's heavily driven by silent vascular damage, is aggressive targeting of the vasculature our most immediate effective weapon against the dementia epidemic? The data strongly suggests it is. We can't easily clear amyloid plaques just yet, but we can absolutely control blood pressure and start protecting our small vessels today. Thanks so much for joining me on this explainer, and as always, keep questioning the paradigm.